So today's session, we are looking at HIV/amputation, and we are looking at a scenario question from the June, of course, 2025 scenario paper. So this is what we are dealing with today. We'll go straight to the scenario question, and the scenario question says, Mr. Mlelema, a 43-year-old male, is a non-HIV positive patient and works as a biker. However, he has collided with a tractor and has developed crushing injuries of the left leg. Upon assessment at the hospital, an amputation was suggested that it has been performed. A. Outline 5 goals of antiretroviral therapy. B. State 5 indications for amputation. C. Describe the nursing care you are going to give to Mr. Mlelema in the first 48 hours following surgery. D. Explain 5 HIV preventive measures that you would put in place in the community. Going straight to question A, 5 goals of antiretroviral therapy. The first goal is virological suppression. You will always want to see the viral load reducing. So the goal of ART is that the viral load should reduce, and this will end up improving the CD4 count. Apart from that, the other goal is immunological restoration or increase in the CD4 count. So we want the CD4 count to increase because this will prevent a lot of opportunistic infections that are seen in HIV. Other goals of ART treatment is reduction of HIV-related morbidity and mortality rates. So when we control the virus and help rebuild the system, this at least reduces the rate at which an individual with HIV suffers from illnesses, or also known as opportunistic infections, because most in HIV the patient would die from the opportunistic infections themselves because the immunity is very weak. Also, improvement in the quality of life. We want the patient at least to be active for more than at least 50% or 80% of the days in a month, not whereby the patient is bedridden for majority of the days in a month. Hence, the goal of ART treatment is to also improve the quality of life. Also, prevention of HIV transmission. ART treatment is done to also eliminate the risk of sexually transmitted viruses to the other. This is because when the patient goes into undetectable state and another individual who's also positive is also at undetectable state, this can reduce the transmission of HIV to one another or even from mother to child transmission. So those are some of the goals that we can discuss among others for HIV. Question B says 5 indications for amputation. One of the indications is severe trauma or crash injury, like in the case of Mr. Mulelema's injuries. That is an indication for amputation because he has crash injuries. Also, peripheral vascular disease or critical limb ischemia, where the patient, because of damage to a particular body part or limb because of lack of oxygen supply or blockage, the amputation can be done, especially where there's permanent damage to the affected body part. Other indications includes malignant tumors. Amputation can be done where a bone is completely removed, or soft tissue where the patient maybe has cancers of the bones like osteosarcoma or other cancers affecting limbs, and the only solution may be to remove the affected limb before the cancer spreads to other body parts. Also, life-threatening infections, uncontrollable infections. When we talk about like things to do with gangrene, this may require amputation, especially where the patient maybe has gas gangrene, because we know to say the infection may fastly spread to other body parts. So gangrene is one of the life-threatening infection condition that may be an indication for amputation. Congenital deformities are also indications for amputation, where this particular child is just born with deformities, and hence amputation may still need to be done just to promote a good physical cosmetic appearance. Or maybe that particular limb, the child maybe has 3 limbs, meaning that one which is wrongly placed has to be removed. In terms of the hands, if there are 3, one has to be removed just to maintain normal cosmetic appearance, and also just promote proper growth and development. The last question said nursing care for Mr. Mulerema in the first 48 hours following surgery. So this says nursing care, and you start from environment, talk about environment, what you do, promoting a patent airway, because the patient, even if they're undergoing amputation, they may have been on general anesthesia. So talk about promoting a patent airway, promoting adequate breathing, talk about promoting adequate circulation, talk about care of the drainage tubes, because there may be drainage tubes coming from the incision site itself. Talk about observations that you are going to do. Pain management, the patient may be on pain postoperatively as they recover from the surgical procedure of amputation. Psychological care, explain to the patient what has been done, and of course talk about nutrition, talk about wound care so that you avoid infections on the site, talk about exercise, talk about hygiene, and of course you talk about elimination. So this is the nursing care that we can still give to the patient postoperatively after surgery. Of course, the last question said 5 HIV preventive measures to put in place in the community. Among the 5 preventive measures, you can talk about comprehensive sexual education and promotion of condom use. Sex education is cardinal, and people are aware about HIV, how it is transmitted. They can still be willing to put in measures to prevent themselves from contracting HIV. Promotion of HIV testing and counseling. This will help people know their status and initiate treatment as quickly as possible. Other interventions, it could be practicing safe sex, like use of the condom, like I've mentioned. Also abstinence. You can still advise people to abstain from sexual intercourse until they are ready to do so, or just to their own partner. Apart from that, you can talk about use of pre-exposure prophylaxis as a way to prevent HIV. You can talk about use of post-exposure prophylaxis, avoiding sharing needles or sharp objects, health education, and also, of course, behavior change as well can still be promoted or done. So that is how we can attempt this question for HIV. So till next time, that's all. Goodbye.